wonderful good evening, everyone, and welcome to the Parent Caregiver webinar on recognizing signs of substance use and addictive behaviors with Dr. Tula Kurkatakis. Before we get started, I would like to introduce myself. My name is Gwendolyn Fearing Affleck, and I am a team member at School Mental Health Ontario as the Addictions Prevention and Literacy Area Lead Consultant and the Addictions Specialty Coach. I am a social worker by training and have worked over 10 years in both community child and youth mental health services and school social work practice.
Hi everyone, I'm Masida Majid. I'm a parent-peer consultant with School Mental Health Ontario. And as Peter mentioned, I will be one of the moderators for tonight, and I'm very happy to be here with all of you. I'll pass it on to Sylvie.
Thank you so much, Masida. Hello, everyone, and welcome again. My name is Sylvie Nuti, and I'm also pleased to be with you today. I work as a French addiction prevention consultant here at Etemechan, School Mental Health Ontario. I'm a social worker by training, and I'm also part of the prevention and early intervention team, as well as the parent and caregiver mental health literacy and student engagement teams. So, but beyond my professional role, I am also a mom of 5, 3 of whom are in elementary school and 1 in high school. So these conversations around youth well-being and mental health are close to my heart, both personally and professionally. We're so glad you could join us for the second session in our 5-part webinar series. Today's focus is recognizing signs of substance use and addiction behaviors, an important and sometimes difficult topic, but one we want to explore together in a supportive and informed way. So without further ado, I will walk you through the agenda for today. So what you can expect today is that our session today will last approximately 45 minutes. In just a moment, I will go over a few guidelines to help you navigate today's session. I will then briefly introduce who we are at SMHon and take a moment to highlight one of our key results for families, the Parent and Caregivers Learning Hub. Following that, I will introduce our speaker, Dr. Tula, who will guide us through today's presentation. While the presentation is taking place, the Zoom Q&A box located at the bottom of your screen will remain open. We encourage you to enter your questions there as they come to mind. This will allow us to organize them in advance of the Q&A period. Once the presentation is complete, I will begin by asking a few pre-submitted questions after that, my colleague Masida will read additional questions from the Q&A box. And before we close, we will ask you to complete a short evaluation form. Your feedback is essential in helping us improve future sessions and better support you. Who are we? School Mental Health Ontario. School Mental Health Ontario is a provincial implementation support team which helps schools district enhance student mental health through the use of evidence-informed strategies, services, and implementation support. We invite you to subscribe to our website using the QR code to stay updated on the latest information and resources, and to follow us on the various social media platforms you see there on the slides. So now, this year, School Mental Health Ontario launched the By Your Side Parent and Caregiver Learning Hub. It is a resource that is designed to support you in promoting mental health and well-being at home. We know that as parents and caregivers, you are already using many effective tools and strategies to support your children's physical and emotional health. By Your Side recognizes this strength and builds on it by offering accessible, evidence-informed resources on a variety of topics related to mental health and substance use. So the QR code currently displayed on the screen will take you directly to the Learning Hub, where you can explore these resources at your convenience. And just a quick note, you'll find that some of our materials are available in multiple languages, not just English and French, to better reflect and support the diversity of families across Ontario. So now, it is truly a pleasure to welcome our guest speaker today, Dr. Tula. Dr. Tula is a dedicated social worker and family therapist with over 30 years of experience supporting children, youth, couples, and family across a wide range of settings, from child protection and schools to mental health and addiction services, hospitals, community organization, and private practice. She currently serves as an associate professor at the School of Social Work at Université de Laval, where she also leads the PhD program. Dr. Tula's research focuses on youth mental health and addictions, the role of families in treatment, and how we train and support the next generation of mental health professionals. Among her current projects are important studies on youth suicide prevention and cannabis use among youth and young adults in the context of legalization in Canada. We are so grateful to have her with us today to share her knowledge, experience, and compassionate lens on these important topics. So, Dr. Tula, welcome and thank you for being here with us today.
All right, so thank you very much. As a former school social worker in a very long time ago, I am really pleased to be able to do this webinar as part of the Parent Caregiver webinar series offered by School Mental Health Ontario. In addition, I think it falls quite nicely on this day. It is National Child and Youth Mental Health Day, it's Mental Health Week, and it's also International Harm Reduction Day. So there is a whole lot happening on this day that really touches on the topic that we will be talking about today. So we have 3 objectives for today's topic. The first objective is to understand the prevalence of substance use and behavioral addictions among adolescents in Ontario. The second is to recognize the possible signs of problematic substance use and technology-related behaviors, including video gaming and gambling. The third is to identify strategies to support your youth and to address concerns about substance use and behavioral addictions. And at the end, there will be some time for questions, as I believe the moderators have explained. So we'll start with an overview of commonly used substances among youth in Ontario. The Ontario Student Drug Use and Health Survey, or OSTIS, monitors trends in substance use and mental health among students in grades 7 to 12 across the province. According to the most recent data, the most commonly used substances among students in the past year were alcohol, opioid pain relievers used non-medically by youth, cannabis, and e-cigarettes or vapes, with slightly higher rates in all of these substances among girls. A significant proportion of students engage in polysubstance use, which means using more than one substance at a time. The most frequent combination reported is alcohol and cannabis. Canada has one of the highest rates of cannabis use among youth worldwide. The average age that youth have their first drink is 13, and cannabis at the age of 14. Youth are particularly vulnerable to cannabis-related harms. This vulnerability is heightened when cannabis use begins at a younger age, when there's higher potency of THC products that are used, when use becomes more frequent, and when use leads to dependency. Since legalization, the prevalence of cannabis use has increased, as has the number of hospitalizations related to cannabis harms, including a significant rise in cannabis-induced psychosis. One of the key objectives of legalization in Canada was to protect youth by limiting access and providing education on the risks. However, we've seen a normalization of cannabis use and a minimization of its harms, in part driven by commercialization. For example, Ontario operates a private retail model with more than 1,700 cannabis stores across the province, the highest number in Canada. Quebec, on the other hand, has adopted a public health model with fewer than 100 stores and stricter regulations, including a minimum legal age requirement of 21, restrictions on advertising, restrictions on signage, really strict rules around store locations, and the reinvestment of profits into cannabis research and education. Probably not coincidentally, Quebec reports the lowest rates of cannabis use and related health problems in the country. The reason that I'm providing you with this information is I think this information is important for parents because without a clear understanding of the risks and harms, as well as the factors that contribute to higher substance use and those that support a public health approach, it becomes more difficult to make informed decisions, makes it more difficult for us to educate youth and to advocate effectively for our kids. So to give a clear picture of the current landscape, I'll also share some statistics from the Ontario Student Drug Use and Health Survey related to behavioral addictions. About 8% of youth students report betting money on online games, such as online casino games or sports betting, and 28% play video games daily, with higher rates among boys for both gambling and gaming. 94% of students use social media daily, and 23% spend 5 hours or more on social media each day. 78% of students spend 3 hours or more per day in front of a screen during their free time. This amount of screen time exceeds the Canadian 24-hour movement guidelines for children and youth. And you may have heard on the news, but Quebec is going to really make a major decision starting in the fall where they will be eliminating phones from schools in over 400 schools, and they are on a movement to really abolish telephones in schools altogether. So it is quite a bold move, and it is something that we have been hearing a lot more about. The following section provides information to help parents recognize signs of problematic substance use and technology-related behaviors, including video gaming and gambling. Often parents may notice some of these signs, but it can be difficult to determine whether they are cause for concern. You know your child or your youth best, so trust your instincts if something is off. Please keep in mind that these signs are not necessarily on their own indicators of a serious problem. It is also important to know that substance use and behavioral addictions, such as gaming or gambling, exist on a continuum. This means that behaviors can range from no use to occasional, to non-problematic use, to frequent or regular use, to more intense or problematic use that may begin to interfere with a young person's health, mental health, school, relationships, and overall functioning. One of the first signs to pay attention to is a noticeable increase or change in your child's substance use, gambling, or video gaming. This could include more frequent use, experimenting with new substances, or engaging in binge use. You may also know patterns developing, such as using cannabis every evening to fall asleep or staying up all night to play video games. Young people aged 15 to 24 are more likely to experience mental health and substance concerns than any other age group. They are also more vulnerable than older individuals because their brains are still developing. And this is the stage of life when most mental health challenges first emerge. Youth who struggle with substance use, problem gambling, or problematic video gaming are also more likely to experience mental health difficulties, resulting in what are known as co-occurring issues or concurrent disorders. Some youth begin using substances as a way to cope with stress, anxiety, depression, or other emotional struggles. Those dealing with intense emotions or trauma may also turn to substances for relief, to numb their feelings, or even to escape. While substances might offer short-term relief, it often becomes more harmful over time, and it can worsen mental health symptoms. Parents may notice changes in their child's mood and behavior when substance use is used and when it becomes more problematic. And some of the things that parents might notice are increased irritability, difficulty managing emotions, decreased motivation, or signs of feeling down or depressed. Substance use can also affect a young person's physical health, and parents may notice signs such as changes in sleep patterns, appetite, unexpected weight loss or gain, or a decline in overall energy. Parents often worry about the negative influence of peer pressure related to drugs and alcohol, especially when there are changes such as starting a new school, forming a new friend group, becoming more secretive or dishonest, or going out more frequently. That said, it's important to remember that friendships, increasing autonomy, and even some degree of risk-taking are normal parts of adolescent development. It's not uncommon for youth to hide information or to lie to a parent, as difficult as we find that, if they think their parent will be upset or might say no. While increased social activity and new friendships can raise questions, a noticeable shift in the opposite direction, such as social withdrawal or isolation, can also be a reason for concern. If your child is spending significantly more time alone or losing interest in seeing friends, it might be a sign they're trying to cope with something on their own. Another possible sign of problematic substance use is a decline in grades, increased school absences, or reports from teachers expressing concerns. It is important to consider other factors that affect youth wellness, such as bullying, discrimination, and racism. The OSTIS reports that 25% of students report being bullied at school. The most prevalent form of bullying victimization at school is verbal, and that's followed by physical big bullying, which is about 2%. And that is also followed by theft and vandalism, which is also about 2%. 14% of students have experienced ethnic or racial discrimination and bullying, and 7% have experienced discrimination due to disability, sexual orientation, and gender. Bullying, racism, and discrimination are not signs of substance use, but they are traumatic experiences and major sources of distress for youth. Many do not report these experiences, often due to systemic racism and a broader sense that schools may not be safe or responsive environments. This can place parents in a difficult position, especially when a child shares what they've experienced, but asks the parent not to speak to the school. It's important to keep communication open with your youth and consider seeking additional support to help you navigate a situation like this. In this last section, we will look at some of the strategies to support your youth and address concerns related to substance use and behavioral addictions. So while it can be challenging, open communication about substance use and behavioral addictions is essential. You don't need to be an expert on all substances to have meaningful conversations with your youth. What matters most is showing openness, care, and willingness to listen. Here are a few suggestions that may help foster more supportive conversations with your youth. Choose the right time and place. If your youth comes home late and you've been worried sick, that may not be the ideal moment for a serious discussion. You may both need time to calm down and regulate intense emotions before you're ready to talk and really hear each other. Practice active listening so that you are listening by maintaining eye contact, avoiding interruptions, asking clarifying questions, and summarizing what you've heard. Demonstrating genuine curiosity about their thoughts and feelings helps your youth feel heard and respected. Give them space to express themselves, as this can be very empowering. Use I statements. When sharing your concerns, focus on your own thoughts and feelings rather than pointing fingers. For example, I worry when I don't hear back from you, or I appreciate knowing where you are when you go out, instead of, you said you'd be home by 11, or you always say you'll do it and then you don't follow through. I statements reduce the chance of sounding blaming or critical, and you're more likely to have openness from your youth to engage in a conversation. Another tip in terms of communication is keeping it short and positive. For most youth, shorter conversations are more effective. A calm and respectful 5-minute exchange is often more meaningful than a long conversation that feels like a lecture or ends in conflict. What can be a little bit tricky is sometimes youth may open up and start to talk about something. It's up to the parent to be able to know when it's enough and when we need to maybe stop digging, because sometimes it can be a lot for a youth to spend an elaborate amount of time talking about something a little more intense. Stay focused on the present. When a young person doesn't see their behavior as a problem, parents often bring up past examples to make their point. While well-intentioned, this can sometimes lead to feelings of shame and guilt, which may cause the youth to shut down or deny the issue. Focusing on what's happening now creates more room for dialogue. Soften your approach. A softer tone or gentler choice of words can make a difference. The way something is said is often more important, or often matters just as much as what is being said. The next strategy, helpful strategy in keeping communication open with your youth, is learning how to validate their experiences, even when you disagree with their choices or behavior. Validation doesn't mean approving of or encouraging substance use. It means showing your child that you're trying to understand their feelings or experiences without immediately correcting, criticizing, or trying to fix them. For many youth, substance use is linked to stress, anxiety, peer pressure, curiosity, or a desire to escape. For youth who use substances, validation can reduce shame and defensiveness and help them feel heard and respected. Here are some examples of what validation can sound like. I know it's not easy to say no when your friends are doing it too. You've been through a lot lately, and I get that you're trying to find a way to cope. Thank you for being honest with me. That means a lot. Setting expectations and limits can be one of the more challenging aspects of parenting, especially when emotions run high or trust has been tested. It starts with having clear and reasonable expectations. These might include curfews, expectations around honesty, screen time, rules about using substances at home or at school. Limits work best when they're discussed ahead of time, not just in the heat of the moment. Be clear about the consequences if limits are broken. Consequences should be fair, they should be related to the behavior, and they should be something that you're prepared to follow through on. For example, losing access to a privilege for a period of time. Let your youth know that the goal isn't punishment, but about supporting safety, responsibility, and trust. Whenever possible, involve your youth in setting limits and consequences. This builds trust and gives them a sense of responsibility. When youth feel like their voice matters, they're more likely to respect the limits and more willing to come to you when something goes wrong. Here are a couple of ways you might approach the conversation. Let's agree together on a reasonable curfew. What do you think would be a fair consequence if this rule isn't followed? When youth are dealing with stress, anxiety, or overwhelming emotions, they may turn to substances or other behaviors like gaming or gambling as a way to escape or feel better. One meaningful way parents can support their youth is by encouraging healthy alternatives for coping with difficult emotions. Coping skills are strategies we use to manage difficult emotions and handle stress without engaging in harmful behaviors. There are many different types of coping strategies, including identification and regulation of emotions, active coping strategies such as going for a walk or a bike ride, relaxing coping strategies like listening to calming music, creative coping strategies such as painting, playing an instrument, journaling, social coping strategies such as playing with a pet, calling a friend, coping strategies that shift your mindset, such as focusing on one thing that you're grateful for, mindfulness coping strategies, which means learning to be present and aware of the current moment without judgment. Youth often look to their parents and caregivers as examples, even if they don't show it. I don't know how many times I have had youth in my sessions tell me something that sounds exactly like something their parents said in the previous session. So even if they're not showing it, they are actually really impressionable and they are really looking up to you. The way that you handle stress, express emotions, and use or avoid substances can strongly influence how your child understands and approaches these behaviors. Being mindful of your own habits around alcohol, cannabis, or other substances is important. Youth are often more aware of what's happening around them than adults may realize, even when it seems like they're not paying attention. Cultivating hope is important, not only for your youth, but also for you as a parent, especially during difficult times. Supporting a child who is struggling can feel heavy, and it's easy to lose sight of what's possible when faced with ongoing worry, frustration, or uncertainty. Hope is a reminder to both you and your youth that you have strengths to mobilize and build on, that change is possible, that support exists, and that you are not alone. Finding moments to connect with your youth is super important. This can include watching a movie together, going for a walk, cooking a meal, or just being present. Make sure to keep those moments sacred and not discuss serious issues during your moments of connection. Self-compassion means treating yourself with the same care and understanding that you would offer someone you love. It's especially important when you're facing stress, doubt, or difficult emotions as a parent. This is something a lot of parents struggle with. Parents are often very focused on their children and have a really hard time to be able to turn inward and look at what's going on with themselves, and giving themselves some self-compassion and a little bit of time to take care of what's happening with oneself. Psychologist Kristen Neff describes self-compassion as a way of emotionally recharging our batteries. Self-compassion includes 3 key components: mindfulness, which means being aware of your experience without ignoring difficult feelings or judging yourself. Self-kindness means being gentle and understanding with yourself instead of self-critical. Remind yourself, I'm doing the best that I can. Common humanity is recognizing that you are not alone. Struggles, pain, and setbacks are part of the human experience, just like joy, connection, and growth. It's common for families and youth to feel alone or hesitant to reach out when facing challenges, especially since substance use is often surrounded by stigma. Support can come from many sources, including family, friends, community members, spiritual or faith leaders, or mental health professionals. Peer support can also be incredibly helpful. Connecting with others who have had similar experiences can be validating, reduce feelings of isolation, help normalize what you're going through, and offer a sense of hope. Peer support can also be really valuable for your youth. Parents are usually their child's strongest champions. This can include advocating for services, ensuring the learning environment is supportive, coordinating care, and navigating mental health care systems. Youth may not be in a position to advocate for themselves, and parent advocacy helps ensure their needs and their rights are recognized and met. Thank you to everyone who joined today, and a special thank you to School Mental Health Ontario for the invitation to lead this important conversation. We have a few questions which I would be happy to respond to at this time.
Thank you so much, Dr. Tula, for that rich and informative presentation. We truly appreciate the depth and insight you've brought to today's session. We will now move into the Q&A portion of the webinar. We will begin with a few predetermined questions we received in advance from parents and caregivers. So let's start with the first question. So the first question is, how do you recognize behavior addiction? For example, checking a cell phone repeatedly, and how to begin a constructive conversation with a child or youth on observations?
That's a great question, and there is some information that is missing, so I'm going to do my best to answer the question, and hopefully I will answer it adequately for you. Unfortunately, checking the cell phone repeatedly is quite common in youth. Before starting a conversation, it may be helpful for you to reflect on what you are most concerned about, or what is most important for you. For example, is it the amount of time your youth is spending on the phone? Is it the compulsive checking? Is it not being able to have a conversation with you when they're constantly looking at their phone as you're trying to speak to them? I think it will be a more effective, less overwhelming conversation for your youth if you can identify one thing that you would like to make your youth aware of. Once you have identified that one area, think about when and how you will present this to your youth with a soft approach, as I mentioned earlier, and using I messages so it does not sound like an attack. Hoping that responded to your question.
Thank you for the thoughtful answer. So I will then move to the second question, which is, what are some of the key signs to look out for? And more specifically, what might be the earliest indicators that a teen could be starting to experience trouble with substance use?
So we do have another question that resembles this one, and we did cover this in the PowerPoint, so I'm not going to go back over it, but I will say that as a parent, it's important to make note of the signs that you see. So you're kind of tracking, you're measuring, you're trying to see what exactly is going on, what am I noticing, what am I observing? And ultimately, I think I mentioned this earlier as well, trust your instinct as a parent. You know your child. If there's something that just does not feel right for you, that's often your first sign right there.
I love when you say trust your instinct. I think it resonates with all the parents in this webinar. So, and the third question was, identifying excessive internet or gaming use is easy, but how do you effectively reduce screen time without physical or verbal abuse from your teenager who is 16, a foot, and more than double your size?
Yeah, it is tough when they start to be bigger than we are. Still big babies at heart, quite often, but their size can be a little bit intimidating. And this is where, it's the push and pull of adolescence that makes it so difficult. In some ways, they're trying to convince us, and maybe, themselves as well, that they are growing up. And in many ways they are. In other ways, we can see that they are still quite young and immature. There's no doubt that when they are bigger than the parent, it can be intimidating to enforce limits. I'm not sure if the age was 16 that was mentioned, but the age of the youth is certainly an important consideration in terms of the types of limits that you set with your youth. It's also important to keep in mind how your youth is doing in other spheres of their life. Is their screen time affecting school? Is it affecting their social life? Is it affecting activities? Is it creating family conflict? It is important to have a conversation at the right moment with your youth. But first, as I mentioned previously, give some thought to what is important for you. What part of that limit expectation is negotiable and what part is not? Is there a way to present it to your youth as a choice so your youth feels empowered and thinks that they have some independence? For example, with younger youth, some parents are adamant about the phone and computer not being in their bedroom while they sleep. That is the non-negotiable part of it. To make the youth feel they have a say, some parents give them the choice between keeping it in the kitchen, let's say, or in another common space, or it's staying in the parent's bedroom all night. As you can guess, most youth choose the kitchen, but parents can specify that if they do not respect the phone staying there all night, because there will be some youth who will try to sneak in and try and go and get their phone during the night. So I would suggest that is something that you set up as a limit to make sure that you have in advance, let them know that if they do something like that, they will lose the privilege of having it in the kitchen and that it will go perhaps to the parent's bedroom. Hope that answered your question.
I hope so. So that's really speak to the struggle many families might face. And I think that a lot of parents here will relate to that question. So now the last question, but not the least, some children with pre-existing anxiety disorder fared poorly coming through the pandemic and are now failing to launch in early adulthood. My son has added substance use as a treatment for anxiety, as it is very normalized for this age group. How do parents help these children learn to combat isolation and anxiety when they are unwilling to meet face-to-face with a counselor or coach or even interact with strangers?
It's a great question. And I must say that it is something I did see quite a bit in my practice during the pandemic and post-pandemic, and something that I'm continuing to also see in my research is just the ripple effect that this has had, that this has had on young people. The pandemic was really difficult for many youth and young adults. And for those who are already struggling, the isolation, the excessive screen time, the availability of substances such as cannabis, the limited access to services, amplified both mental health and substance use concerns for youth. Um, I suggest thinking about what would be a first step that might help you feel that things are moving in the right direction for your youth or young adult. Is it getting professional help? Is it reducing substance use? Is it finding employment? For many parents, it's understandable to want your youth or young adult to make changes. But if that's not happening, what would be most helpful for you if your youth is really not budging? I'm not sure if you've already had any services, but I would suggest two services that might be helpful. Now, I'm also not sure where you are in Ontario, but there is a service that serves families, and it is a service that was created by families for families. It's called Families for Addiction Recovery, which is a peer support service that is available. It's virtual and it's by telephone, and it's very low barrier, easily accessible. If you are searching for services for your youth, there are mental health services that are available throughout the province. If you happen to be in a region, in a district that has family navigation services, this can be extremely helpful for parents because sometimes parents just don't know which service is the best service. The GTA definitely has a family navigation program, and it is starting to grow in other parts of the province as well. Navigators, basically what they do, it's not a telephone line where they just give you 3 phone numbers and off you go. It really is an accompaniment. It really is an opportunity for somebody to hear what you're looking for, what your needs are, what your youth's needs are, and to try to match you with the most appropriate service, or to also match your youth with the most appropriate service, provided that your youth is in agreement. So that might be an option if you are looking for services for your youth. Now, if you are talking to your youth about services, something I would suggest is doing your homework before you talk to your youth. I know many parents say this, that when they finally are ready, you want to be able to have that service available and ready to go, because sometimes the window feels like it's very, very small, the time that you have. So doing a little bit of homework and being able to propose a service, an option to your youth can be quite helpful. And sometimes it can actually be even a bit more helpful and strategic in some ways to have more than one option, because again, it may make a youth who is feeling a bit down that they do have some choice in the option. So if you are presenting them with, there's this, and there's this, which one would work best for you? Now, the other thing that I would just also mention is, if your youth is not protesting and is not saying, no, I don't want services, but is also not agreeing right away, let it sit. Don't push too hard the first time you have the conversation with your youth. Give them a little bit of time to sit with it. Say to them, I know I gave you a lot of information. I appreciate that you're hearing what I have to say. What about if we come back to this in a day or two? And just kind of let it go there. Sometimes if we push too hard, it may make them kind of take a step back because they feel overwhelmed and they might panic a little bit. So we did have, I think, one last question. Is that possible?
That was the last pre-asked question. And so thank you so much for your thoughtful responses for these first questions. You've provided a lot of clarity and practical insight, which I know is deeply appreciated by the audience. And we will now move to the live Q&A portion, and I will pass it over to my colleague Masida, who will share some of the questions that have been coming in the Zoom Q&A box. Masida, you take it over.
Thanks so much, Sylvie. Hi again, Dr. Tula.
Hello.
So now, as Sylvie mentioned, I'll just read out some of the questions that have come in through the live Q&A. The first question is, what are non-medical opioids?
It's a great question. So non-medical opioids are opioids that do not have a prescription. Pardon me, they may have a prescription, but not for the person who's using them. So somebody is using them in a way that is not a prescriptive use of opioids. And they may be getting them from a parent. They may actually have a prescription for them, but they're not using them in the way that the prescription requires them to use it. They may be buying it from a friend from school. And this is something that is happening more and more, that youth are sharing some of the medication that they have with peers, or selling some of the medication that they have with peers. So it is something that is concerning. With the fentanyl crisis that we have had over the last number of years, which I'm sure most parents have heard about, something that we are hearing more and more is that people who are using fentanyl are selling some of the substances that they have that are not as strong as fentanyl to young people, and they're selling it much cheaper than it would have been once upon a time. So youth are able to purchase some of the pills that would have cost $60 a long time ago for $2, $5, and it has become much more accessible.
Thank you so much for that explanation. That's helpful. And the second question, you've mentioned a little bit about cell phone bans in Quebec, and this question is on a similar topic. And the question is, what advice do you have for a parent when a school declines to enforce a stated ban on cell phone use in class?
That's a really great question, because parents, it's really tough when parents are trying to take on a system by themselves. I would say to band together with other parents, 2, 3, 5, 10, 50, there really is strength in numbers. So assemble, start to have, like-minded parents. You'll encounter some parents who will disagree, who will find it too difficult, who will find it overwhelming, who will not be sure how to take this on, who will worry that if their child doesn't have a phone at school, it may bring up some anxiety for their youth. There's a lot of worries. We really have become very dependent on having these phones, having our kids have phones with them at all times. On the other hand, we also know that as long as that phone is in their pocket, is in their locker, even if they're not supposed to use it, the fact that it is on them or with them is right there. It's a distraction for them. It makes it very difficult to be able to do that. So my recommendation would really be to try to gather together parents and your school social worker. I mean, I don't know if they would be able to get involved, but there is no harm in contacting the professionals from your school, talking to school personnel who might be allies, to see where you can go with that. Contact schools who have been successful and have managed to ban cell phone use, to find out what they're doing. That way you might have a few arguments if, let's say, the principal or the school is coming back with, an explanation on why they think it's not going to work. Well, if you have a school that is a success story and is doing it, that can be extremely helpful to be able to kind of use some of those examples as a case example.
Thanks so much. Those are sort of power numbers is a way of advocating, right? That's what advocating strategies. That's great. And I think it's comforting for parents to sort of carry the weight with other parents. So it's not as heavy, for sure. That's very helpful. The other question we have is around gaming and social media behaviors, and there's several under, so I'll just ask them one at a time. The first one is, my child is addicted to Roblox. How do I handle this?
Yeah, it is not easy when there is a video gaming addiction. I'm not sure how old your child is, but I think it's important to maybe just take a little bit of a step back, which again, I don't have any information right now. So some of this, it might be things you've already done, you've already tried, but thinking about, What is the problem? When is it a problem? Are there specific moments that are more triggers than others? What has worked in the past? Is it specifically only with one video game? Kind of assess the situation yourself. Do really an assessment of your situation. And then once you kind of have all of your own information really properly gathered and organized, then start to think about what would be needed. What is kind of a reasonable harm reduction way of starting. Now, I'm not saying that that means every parent needs to do it this way, but if you are having difficulty, it might be hard to go from, what you used, which is addicted, to not using at all or not playing at all. So, you might want to think about, is there a way to start with reducing, especially at specific hours, specific times that interfere most with your youth's health, your youth's mental health, your youth's homework, family time, anything else. So trying to kind of think about what would be some of the ways that you could do that, what would be some consequences. Once you've had an opportunity to really give that some thought, then bring your youth into the conversation. Let them know that you would like to have a conversation with them, as opposed to trying to find kind of a quiet moment when they seem calm and whatnot. While that might feel like it's kind of an easier way to do it, it often doesn't necessarily result in a positive outcome, because youth feel ambushed in those kinds of situations. Now, parents will also say, okay, I tried what you said. I told my youth, we need to have a talk in the next 2 days. You tell me when, but we do need to have a talk. And in the end, the youth never comes back with a time. So the parent is waiting and waiting and waiting. So, being much more firm about it and letting your youth know that you do need to have a conversation. When is the right time? And if they're not coming back to you with a time by a certain date or by a certain hour, then you'll be the one that will select the time to be able to have that conversation. And again, you don't need to solve everything in the first conversation with your youth. So when you're doing your own brainstorming and kind of trying to think about, okay, what's going on here? What's kind of at play? What's interfering the most? Also think about how you can break this down and discuss it with your youth in parts. So it's not too much all at once. What would be maybe the first step? What would be something you would want to discuss in the first conversation? Would it really just be first conversation would be the first opportunity to just start to talk about it without necessarily having a concrete outcome? That could be an option, but giving it a little bit of thought so that you're not trying to accomplish too much in that first conversation.
Thanks so much, Dr. Tula. I know that we are running out of time, so we may not be able to ask and answer all the questions that was given to us today, so we do apologize for this. So maybe I'll ask the next one, which is related to substance use. How can I help my child who is concerned about a friend who is exhibiting substance abuse?
Can you reread the question, please?
Yeah. How can I help my child who is concerned about a friend who is exhibiting substance use, who's showing, yeah.
That's an excellent question. So it sounds like you're not concerned about your youth substance use, but you're concerned about the way this is impacting your youth, and how your youth can support their friend. And I can understand how that can be really, how a parent can feel torn in a situation like that. On the one hand, you want your youth to be able to support a friend. You want them to learn how to have that type of generosity and empathy. And on the other hand, I can also understand how it's worrisome if the other person is involved in behaviors that you don't want your youth to be involved in. Have a conversation with your youth where really, especially in the first conversation, where most of what you do in that first conversation is actively listen and take a position of curiosity where, you're asking questions, but questions that don't sound like an inquisition, questions where you're trying to better understand, where you're giving space for your youth to talk about it, where you're trying to understand what your youth is grappling with in this situation. What do they think would be important? What do they know about their friend? What do they think would help with their friend? What are they worried about in that kind of situation? And it would be tricky, but try to refrain from solving the problem right away and jumping to kind of propose solutions. You could ask your youth, what would be most helpful for me? That can be a way of you kind of getting a better understanding. Do they want solutions, or do they kind of already have a clear idea of what they want to do and they just want you to listen to what's going on with them?
Thanks so much. We do have a few more questions, but we are running out of time, so I apologize if we didn't get to your questions. Thank you so much again, Dr. Tula, for your presentation and answering all of our questions. Has definitely offered us important information, but also reminders, right? He's talked a lot about self-care, things that we as parents know, but it's nice to be reminded, and we're leaving you with some new takeaways. And I want to thank all of you for sending in your questions and for joining us this evening for our webinar. And just before we wrap up, we'd like to offer some ways that folks can support their children in case of a mental health concern. You could speak to your child's classroom teacher, school principal, or a staff member that you feel comfortable with about supporting a referral to a school mental health professional. You could also speak with your family doctor and they can help connect your child with mental health services, or visit One Stop Talk to connect with a therapist from anywhere in Ontario. And if folks want further details, you could scan the QR code you see on the screen and it'll take you to our By Your Side Learning Hub where you can get more information.